Alright, this is Ubaid on behalf of Electronics, and in this video we'll be filling in a medical report that is required for school and transit bus drivers. Okay, so let's go ahead and talk about some of the terms as well as some of the items on this report. Okay, starting with disease of the senses. Okay, so you do need to know disease such as deafness, okay, vertigo, visual deficiencies. Okay, so when it comes to deafness, okay, this has to do with your medical questionnaire on the medical report, okay, with a yes or no answer. Okay, so deafness and hearing loss can be because of a number of reasons. It covers aging, ear wax buildup, okay, head trauma, okay, symptoms like difficulty hearing, ringing in the ears, and trouble understanding speech. Okay, treatments include hearing aids, implants, and medication. All right. So when it comes to hearing loss level, and this is something that you can type in on your report, okay, this can either be mild, moderate, severe, and profound. Okay, when it comes to mild, can understand one-to-one conversations, but has trouble in noisy places. Okay, moderate, has trouble understanding conversations in person and on the phone. Severe, has difficulty following conversations even with a hearing aid. And profound, has very little or no hearing. Okay, so when it comes to a physical exam for deafness, such as one for your medical report, this may include, okay, an otoscopic exam of the ear, a tuning fork test, and an audiogram. Okay, detailed history and other tests can help figure out the cause of hearing loss. Okay, so for the physical exam, the doctor examines the ear canal and the eardrum. Okay, the doctor looks for ear wax, infections, and other substances that may be interfering with your hearing. Okay, and the doctor may also identify structural damage to your ear. Okay, when it comes to your tuning fork test, okay, the doctor places a vibrating tuning fork against parts of your face, your face, head, and ears. Okay, the patient identifies where the sound is the loudest. Okay, for audiogram, an audiologist, okay, specialist in hearing loss, performs this more thorough test. Okay, this is a more thorough test. Okay, the audiogram measures hearing levels and compares them with standards. Okay, the audiogram shows how well the patient hears pitches and sound. Okay, all right. So your medical report, okay, when it comes to your hearing loss, okay, you will either say yes or no on your medical report. Okay, this has to do with disease of the senses. Okay, let's move forward. Okay, next up is vertigo. Okay, so when it comes to vertigo, this is a medical condition, okay, characterized by a false sensation of spinning or movement, even when stationary. Okay, so you're basically feeling dizzy. Okay, you feel that the world is spinning around you. Okay, so on and so forth. Okay, so it's caused by an imbalance in the inner ears vestibular system, which is responsible for maintaining balance and orientation. Okay, symptoms: dizziness, nausea and vomiting, blurred vision, ringing in the ears, unsteadiness and difficulty with balance, sensation of spinning. Okay, causes: okay, this can be because of migraines, okay, strokes, infection, head trauma, multiple sclerosis, certain medications, and other disease. Okay, treatment. Okay, for migraines, you have medications. Okay, stroke, okay, you may require immediate medical attention. Okay, and other causes. Okay, the treatment for other causes may include, but not limited to, antibiotics, physical therapy, or surgery. Okay, so when it comes to diagnostics or diagnosis of this disease, okay, this basically covers a detailed description of the patient's symptoms, a thorough medical history, a physical examination with specific maneuvers, okay, certain tests, okay, that the doctors perform on the patient, okay, to diagnose this disease. All right. Now, when it comes to diagnosis. Okay, you may also check the medical history if this is the doctor's office. All right, you may check the medical history of the patient for recent head trauma, ear infections, viral illnesses, okay, family history of vestibular disorders, medications that the patient might be taking. All right. Okay. All right, so medical history. Okay, test results when it comes to tests. Okay, you've got different types of tests. You have ENG, okay, VNG, okay, lab test, and audiometry. All right, so for your physical exam, this covers an ear exam, eye exam, and neurological exam. Okay, other tests may include, but not limited to, hearing test and cardiovascular checks. Okay, ear exam, okay, eye exam, neurological exam, cardiovascular exam, and hearing test. Okay, next up is visual deficiencies. Okay, and again, this has to do with disease of the senses. Okay, this is also known as vision impairment. These are conditions that cause partial or total loss of vision. Okay, causes, okay, disease or degenerative disorders like cataracts, okay, diabetic, retinopathy, okay, injury, congenital defects like refractive errors, okay, symptoms, okay, loss of visual acuity, loss of visual field, okay, visual distortion, color blindness, so on and so forth. Okay, treatment, eyeglasses can correct some vision impairments. Okay, low vision specialists can develop personalized treatment plans. All right, so medical review may include an assessment of visual acuity, visual field, and other eye conditions. Okay, treatments, okay, may include but not limited to eyeglasses, contact lenses, eye drops, and surgery. Okay, so for the assessment, you have visual acuity, how clearly a person can see. Okay, visual field, how wide an area, okay, how wide an area a person can see without moving their eyes or head. Okay, other eye conditions such as cataracts, which can be treated by replacing the clouded lens with an artificial lens. Okay, so for your visual acuity, they may use a Sneller chart. Okay, visual field, this is more of a physical examination. Okay. All right, so next up is a cardiovascular disease. You do have a question relevant to cardiovascular disease with a yes and no option. Okay, now cardiovascular disease may include but not limited to heart failure, angina, infarction, embolism, arrhythmia, syncope, and surgery. Okay, so for heart failure, symptoms include but not limited to shortness of breath, fatigue, swelling, and irregular heartbeats. Okay, so when it comes to swelling, you have swelling in the ankles, legs, feet, or abdomen, swelling in the belly area, okay, puffness of tissue right under the skin. So this all has to do with your physical examination. Okay, other symptoms include but not limited to coughing up mucus with blood, okay, bluish color in the fingertips and lips, okay, sudden unexpected weight gain, okay, trouble focusing or concentrating, loss of appetite, okay, need to urinate at night. Okay, this is a chronic condition that occurs when the heart can't pump enough oxygen-rich blood, okay, to the rest of the body. There is no cure, but the treatment can help. Okay, so when it comes to diagnostics or diagnosis of this disease, okay, you may have blood test, chest x-ray, ECG, okay, echocardiogram, okay, so on and so forth. Okay, for physical exams, which is relevant to the medical report that we will be filling in, okay, this covers a review of your medical history, okay, listening to your heart and lungs, and checking for swelling. All right. Next up is angina. Okay, so when it comes to angina, angina is basically chest pain or discomfort. Okay, that occurs when the heart doesn't get enough blood and oxygen. Symptoms include but not limited to chest pain, okay, pain that may spread to neck, jaw, arms, or other areas of the body. Okay, shortness of breath, weakness, fatigue, so on and so forth. Okay, causes artery disease, coronary artery disease, which occurs when the arteries that supply blood to the heart narrow or block. Okay, and you do have another condition where fatty deposits called plaques narrow the coronary arteries, okay, leading to a heart attack or cardiovascular disease. Okay, diagnosis, you have ECG, stress test, blood test, chest x-ray, chest CT, CT angiography, okay, cardiac MRI, okay, echocardiogram, so on and so forth. Okay, treatment, medication, surgery, okay, angioplasty, okay, lifestyle changes, okay, nitroglycerin, okay, so on and so forth. Okay, your physical exam may include measuring blood pressure and heart rate, listening to your heart and lungs, and feeling the chest and belly. Okay, so relevant to this physical exam, okay, the findings may be elevated blood pressure, so you're looking at your systolic and diastolic, okay, abnormal heart sounds, okay, so your heart rhythm, such as third or fourth heart sound, okay, sustained outward movement of the left ventricle, okay, murmur of mitral regurgitation, okay, lung crackles, chest valve heave, okay, so on and so forth. Okay, next up is infarction. Okay, so when it comes to infarction, okay, this is also known as heart attack, okay, your myocardial infarction, which may include information on causes. Okay, your medical review may include information on causes, symptoms, diagnosis, treatment, and risk factors. Okay, so causes, you have genetic factors, lifestyle factors. Okay, symptoms, neck pain, back pain, pain in the chest, throat pain, ear discomfort, and hiccups. Okay, diagnostics, ECG, biochemical testing, imaging, and other types of evaluations. Okay, treatment, okay, pain relievers, ACE inhibitors, beta blockers, so on and so forth. Okay, so when it comes to your physical examination relevant to your medical report, okay, this may include checking vital signs, listening to the heart, and assessing breathing. Okay, for vital signs, you're looking for heart rate, blood pressure, temperature, and pulse. Okay, appearance, you're looking for skin, sweating, and behavior. Okay, cardiac findings, you're looking for heart sounds and jugular venous pressure. Okay, respiratory findings, you're looking for breathing and lung sounds. Okay, next up is embolism. This covers a range of topics which covers symptoms, diagnosis, treatment, and risk factors. Okay, so when it comes to symptoms of this disease, okay, chest pain, shortness of breath, okay, cough, okay, palpitations, rapid breathing, increased heart rate, leg swelling. Okay, diagnosis, chest imaging, okay, your D-dimer testing, okay, Geneva scoring, okay, Wells scoring, okay, so on and so forth. Okay, treatment, okay, you have different medications, okay, risk factors, okay, genetics, okay, coexisting conditions such as cancer, sepsis, or illness, and other events like surgeries. Okay, long-term management, okay, this has to do with treatment. So you have rehab, okay, long-term management treatment, emotional stress, quality of life. All right, so when it comes to your physical exam relevant to the report, okay, the doctor may check for swelling, tenderness, redness, and warmth in the legs, as well as listening to your heart and lungs. Okay, so for physical exam findings, legs, they can be swollen, tender, red, and warm areas in the legs or visible veins in the skin. Okay, heart, okay, loud second heart sound, right-sided gallop, or a right ventricular parasternal lift. Okay, lungs, crackles, wheezing, okay, decreased breath sounds, or elevated neck waves. Okay, vital signs, blood pressure, pulse, temperature, and oxygen level. Okay, other tests include but not limited to blood tests and imaging studies. Okay, arrhythmia. This is a medical review. Okay, if we talk about the medical review, this may include information on the types of arrhythmia, their symptoms, causes, and treatments. Okay, so types of arrhythmias, you have different types. Okay, symptoms include but not limited to palpitations, dizziness, fainting, chest discomfort, shortness of breath, fatigue, and anxiety. Okay, causes, genetics, smoking, stress or anxiety, coronary artery disease, heart valve disease, heart failure. Okay, treatment, medications, okay, devices, cardiac ablation, surgery. All right, so when it comes to your physical exam, okay, the doctor may check your pulse, listen to your heart, and look for swelling in your legs. Okay, next up is syncope. Okay, this is also known as fainting. Okay, brief loss of consciousness that occurs before, okay, or when there's not enough blood flowing to your brain. Okay, symptoms include, but not limited to, lightheadedness, nausea, vision changes, skin changes, headaches, and other symptoms. Okay, so when it comes to your physical examination for the report, okay, the doctor may focus on the cardiovascular and nervous system as well as vital signs. Okay, for cardiovascular system, we're talking about blood pressure, heart rate, heart sounds, heart rhythm, heart failure. Nervous system, neurologic exam, okay, so on and so forth. All right, so next up you have respiratory disease, again with a yes or no answer. Okay, so when it comes to respiratory disease, you have disease like asthma, chronic bronchitis, emphysema, so on and so forth. So for asthma, this covers coughing, wheezing, chest tightness, and shortness of breath. Okay, these are the symptoms. Okay, and some of the triggers include, but not limited to, airborne allergens, okay, respiratory infections, physical activity, cold air, air pollutants, okay, certain medications, okay, strong emotions and stress. Okay, when it comes to your physical exam for the medical report, okay, the doctor may look at your upper respiratory tract, listen to your lungs, and measure your vital signs. Okay, next up is chronic bronchitis. This is a lung condition that causes inflammation of the large airways in your lungs. Symptoms include, but not limited to, coughing, wheezing, chest discomfort, shortness of breath, fatigue. All right, now, when it comes to chronic bronchitis, this is a long-term lung condition again. Okay, so for your medical report, okay, you will need symptoms, diagnosis, and treatment of the condition. Okay, for physical exams, the doctors may look for signs of respiratory distress, wheezing, and abnormal breath sounds. All right, next up is emphysema. This may include a discussion of symptoms, causes, diagnosis, and treatment. So when it comes to symptoms, okay, emphysema, shortness of breath, coughing of mucus, wheezing, chest tightness. Okay, causes, inhaling dust from the grain, cotton, wood, or mining products, inhaling fumes from heating, fuel, okay, smog or car exhaust, okay, as well as smoking. Okay, diagnosis, okay, physical exam, okay, lung function test, so on and so forth. Okay, you may also check your medical history. Okay, chest x-rays, CT scans, okay, arterial blood gas test, okay, and ECGs. Okay, treatment, okay, medication to relieve symptoms, medication to reduce swelling in the airways, supplemental oxygen, okay, EBV, lung volume reduction surgery, lung transplant. Okay, physical exam for the medical report may include, but not limited to, listening to your lungs, checking for signs of air trapping, and looking for other signs of the disease. Okay, next up you have disease of the musculoskeletal system. Okay, number 1, fracture. Number 2, amputation. Number 3, arthritis, so on and so forth. All right, so when it comes to fracture, okay, this can be a fracture in the bone, okay, but the symptoms may vary, okay, from person to person. So every person who has a fracture in his or her bone, okay, their symptoms might be different. Okay, so symptoms include, but not limited to, swelling, deformity, and other symptoms. Okay, so for a physical exam, the doctor may perform a visual inspection, palpation, and assessment of movement. Okay, amputation, okay, this has to do with loss of limbs, okay, your hands, your legs, or any other part of the body. Okay, so when it comes to the medical review, it covers a physical exam, psychological assessment, home environment evaluation. Okay, metabolic disorders. This can be caused by a variety of symptoms that covers weight changes, fatigue, and skin changes. All right. So as far as diagnosis is concerned, okay, this is made if at least 3 of the criteria are met. Okay. Treatment. Okay. Lifestyle changes. Okay. Reducing stress, eating a healthy diet, and working out. Okay, so for metabolic disorders, you have diabetes, hypoglycemia, okay, thyroid, so on and so forth. So diabetes, okay, you have symptoms like feeling thirsty, feeling hungry, blurred vision, feeling tired, having dry skin, okay, having sores that heal slowly. Okay, you've got different types of diabetes. You have type 1 and type 2 diabetes, okay? Risk factors: excess weight, waist size, physical activity level, and family history. For your physical exam for diabetes, okay, this may cover, but okay, not limited to checking vital signs, okay, assessing the eyes and the feet, looking for signs of complications. Okay, hypoglycemia, okay, or hypoglycemia. All right, so hypoglycemia or low blood sugar. This is when blood sugar levels drop too low. Symptoms include shakiness, sweatiness, hunger, and dizziness. Okay, symptoms: shakiness or trembling, sweating and chills, extreme hunger, so on and so forth. Okay, treatment. Okay, must be treated promptly. Okay, severe cases of this disease may be dangerous. Okay. So when it comes to your physical exam, this covers checking vital signs, head and eye exam, and neurological exam. Okay, thyroid. This is a gland in the neck that produces hormones that regulate metabolism. Okay, symptoms include, but not limited to, fatigue, weight gain, sensitivity to cold, okay, depressed mood, puffy face, okay, muscle weakness, so on and so forth. All right. Your physical exam may include, but not limited to, inspecting and feeling the neck for any abnormalities in the thyroid gland. Okay, next up you have psychiatric disorders. Okay, physical exam is often part of the mental health assessment to rule out physical causes for mental health issues. You have conditions like psychoneurosis and psychosis. Okay, other examples include, but not limited to, depression, anxiety disorders, bipolar disorders, schizophrenia, okay, post-traumatic stress disorder, OCD, okay, so on and so forth. Okay, psychoneurosis, this is also known as neurosis. This is a common mental illness that covers anxiety, depression, and other distressing emotions. Physical exam, that covers neurological exam, mental status exam, and vital exams. Okay, so vital signs rather. Okay, so you're checking for vital signs. The doctor may check for vital signs. All right, lab test: complete blood count, electrolyte levels, okay, blood urea nitrogen, okay, HIV testing, urine, okay, your thyroid function test, liver function test, so on and so forth. Okay, addictions, okay, when it comes to addictions, we're talking about alcohol addiction, addiction relevant to sedatives, tranquilizers, and narcotics. Okay, so as we know, alcohol is a depressant drug that slows down brain activity, which can lead to a number of symptoms. Okay, you have mental, physical, behavioral, and life-threatening symptoms. Okay, alcohol withdrawal symptoms: headache, anxiety, insomnia, excessive sweating, upset stomach, heart palpitations, so on and so forth. All right, so, okay, when it comes to your physical exam, the doctor may use a breathalyzer, okay, or may check for signs relevant to alcoholism. All right, tranquilizers, okay, you have abuse of pain reliever medication, okay, all right, and you have tranquilizers relevant to sleep aids, okay, and other tranquilizers as listed over here. Okay, signs or symptoms, lapses of memory, lowering of inhibitions. Okay, breathing may be slowed. Okay, other signs include but not limited to finding pill bottles from multiple doctors. Okay, um, narcotics. Okay, signs and symptoms, a sense of feeling high, reduced sense of pain, agitation, slurred speech. Okay, problems with attention and memory. Again, this has to do with narcotics addiction. Okay, problems with coordination, depression, confusion, constipation, so on and so forth. Okay, for physical examination, okay, the doctor may check for pinpoint pupils, okay, nodding off, drowsiness, sweating, okay, restlessness, okay, sweating, okay, sniffles, dilated pupils, muscle tenderness, okay, hypertension, so on and so forth. Other types of disease, okay, on the medical questionnaire include but not limited to blackouts, fainting spells, anemia, cancer, blood, okay, so on and so forth. Okay, so blackout, temporary loss of consciousness or memory. Symptoms include but not limited to sudden loss of consciousness, dizziness, blurred vision, confusion, short-term memory loss, change in mood. Okay, causes, heavy alcohol consumption, certain drugs, epilepsy or migraine, okay, so on and so forth. Okay, when it comes to your diagnostics or diagnosis of the disease and symptoms, you have ECG, echocardiogram, exercise stress test, okay, tilt table test, blood test, okay, so on and so forth. Okay, fainting, okay, this is also known as syncope. Okay, this is a brief loss of consciousness that occurs when the blood flow to the brain is reduced. Symptoms include dizziness, lightheadedness, nausea, and vision changes. Okay, so when it comes to your physical exam, the doctor may check your vital signs, heart rhythm, and blood pressure. Okay, anemia. This is a condition where your body doesn't have enough healthy red blood cells. Okay, symptoms include fatigue, shortness of breath, dizziness, headaches, pale skin, cold hands and feet, loss of appetite, so on and so forth. Other symptoms include, but not limited to, irregular heartbeat, okay, pounding in the ears, numbness and tingling in the hands and feet, blue color to the whites of the eyes, okay, sore or inflamed tongue, okay, abnormal or increased menstrual bleeding in females, okay, so on and so forth. Cancer may have many symptoms that covers fatigue, weight changes, pain, and changes to the skin or bowel habits. Okay, skin changes, yellowing, darkening, or redness of the skin, sores that don't heal. Okay, changes to existing moles, a lump that bleeds or turns scaly, so on and so forth. Okay, so blood dyscrasia. Okay, this is a broad group of disorders that can cause a variety of symptoms that covers fatigue, bleeding, and bruising. All right, so moving forward, your physical exam may include but not limited to checking for signs of bleeding disorders such as bruising, okay, and other signs. Okay, the doctor may also check for other conditions that could cause similar symptoms. All right, neurological disease. Okay, you have seizures, cerebrovascular disease, Parkinson's disease, okay, multiple sclerosis, dementia, head injury, and mental retardation. Okay, again, this is relevant to a yes or no answer on your medical report, okay, under your medical questionnaire. Okay, this has to do with your health history. Okay, so neurological disorders affect the brain, spinal cord, and nerves. Common symptoms: pain, muscle weakness, sensation changes, vision changes, hearing changes, speech changes, cognitive changes, sleep changes, so on and so forth. All right, so when it comes to your physical examination, okay, this is a neurological exam or neuro exam that assesses the nervous system. What's included? Okay, history, physical exam, motor skills, sensory skills, mental status, reflexes, balance, and coordination. Okay, next up you have seizures, temporary surge of electrical activity in the brain that can cause a variety of symptoms, which include but not limited to jerking, staring, stiffening, okay, loss of consciousness, breathing problems, loss of bladder or bowel control, falling, unusual sensations, hallucinations. Okay, warning signs: feeling in the stomach, fear or anxiety, deja vu, okay, dizziness, and loss of balance. Okay, physical exam includes but not limited to a general exam and a neurological exam. This may include checking the skin, eyes, and other organ systems. Cerebrovascular disease. This is a medical emergency that can affect the brain and cause a wide range of symptoms, okay, which include but not limited to headaches, okay, dizziness, weakness, speech problems, vision changes, balance problems, confusion, nausea and vomiting, so on and so forth. Okay, physical exams include but not limited to checking blood pressure, listening to the heart, examining the head and neck. Okay, so you have blood pressure, heart, head and neck, pulse, eyes, skin, neurological exam. Okay, next up you have Parkinson's disease. Okay, this is a progressive nervous system disorder that causes movement problems. Symptoms include but not limited to tremors, muscle stiffness, slowness of movement, impaired balance, trouble walking, pain, sleep problems, mental health problems, and other physical changes. Okay, so when it comes to your Parkinson's disease, you have a neurological exam, imaging tests, lab tests, medication trials. Multiple sclerosis. Okay, this is a disease that damages the protective coating of the nerve fibers in the central nervous system. Symptoms vary from person to person, but includes vision problems, muscle weakness, bladder and bowel issues. Okay, common symptoms, again, dizziness, emotional changes, bladder and bowel problems, numbness and tingling, muscle weakness, vision problems. Other symptoms include, but not limited to fatigue, loss of feeling, memory problems, muscle stiffness, facial weakness or pain, okay, red-green color distortion. Okay, so what's included in the physical exam? You have vision, coordination, balance, reflexes, muscle strength, sensation, hearing, swallowing, and tongue movement. Okay, so the doctor may assess the nervous system, which covers vision, movement, coordination, balance, and reflexes. Okay, dementia. Okay, so when it comes to dementia, okay, some signs and symptoms are memory loss, confusion, and difficulty with thinking and planning. Okay, for your physical exam, okay, this may include a neurological exam and an assessment of the cognitive function. Okay, head injury, okay, covers headaches, dizziness, nausea, and vomiting. All right, so for your physical exam, you have a neurological exam, a vital sign check, and assessment of the mental status. Okay, mental retardation. Okay, this is also known as intellectual disability. It's a condition that affects a person's ability to learn and develop. Okay, signs and symptoms include, but not limited to social difficulties, memory problems, problem-solving difficulties, physical abnormalities, behavioral issues, learning difficulties, so on and so forth. Okay, your physical exam may include, but not limited to measuring growth parameters, assessing nervous system, and evaluating the senses. Okay, next up you have seizure. This is a burst of abnormal electrical activity in the brain that can cause a variety of symptoms. Okay, so symptoms include, but not limited to motor symptoms such as jerking, twitching, stiffening. Okay, behavior symptoms, senses, breathing, bowel or bladder, okay, falls, so on and so forth. Okay, your physical exam includes, but not limited to, a general exam and a neurological exam. All right, so next up you have your medical examination. Okay, this is different than your medical questionnaire, which we covered so far. And your medical examination starts out with eyes. Okay, so you have a visual acuity test, okay, which basically has to do with reading letters from a chart called the Snellen chart. Okay, you stand about 20 feet away from the chart. You read the rows of letters from top to bottom. You cover one eye at a time and read the smallest row of letters you can see clearly. Okay, a 20/20 vision, you have normal visual acuity. 20/40 vision, you need to be 20 feet away to see when someone or what someone with normal vision can see from 40 feet away. Okay, the doctor will perform a visual acuity test with and without glasses to figure out your visual sharpness. Okay, how the test is performed, you'll stand at a specific distance from an eye chart. You'll cover one eye at a time, okay, so on and so forth. We talked about this. Okay, what the results mean: uncorrected vision, corrected vision, abnormal results. All right, so horizontal field of vision. Okay, this is basically 150 degrees around one of your eyes. Okay, so when using both eyes, it expands to approximately 180 degrees. Okay, so how good is your horizontal field of vision? Okay, so when it comes to your horizontal field of vision, this is a measurement of how wide a person can see to the side. Okay, so when it comes to driving, this may have to do with your blind spots. All right, so key points: okay, monocular vision, binocular vision, central vision, peripheral vision. Okay, squint disease or eye injury. Okay, this is a eye condition that causes one or both eyes to look misaligned. Okay, symptoms include but not limited to eyes that don't look in the same direction, double vision, eye strain, tilting the head, squinting or closing one eye, bumping into things, so on and so forth. Okay, squint examination, this covers a cover test, visual acuity test, refraction test, so on and so forth. Eye injury, okay, pain, redness, blurred vision, and light sensitivity. Okay, eye injury symptoms: pain, redness, blurred vision, light sensitivity, tearing, swelling, bleeding, bruising, so on and so forth. Your physical exam may include but not limited to evaluating vision, eyelids, pupils, and other parts of the eye. Okay, for vision, assess visual acuity in both eyes, check for visual field loss, okay, and check for other vision relevant tests. Okay. So eye disease symptoms include blurred vision, pain, redness, and light sensitivity. Okay, symptoms include vision changes, eye pain, eye redness, eye discharge, eyelid changes, and other symptoms. Eye disease type: glaucoma, eye strain, refractive errors, okay, AMD, cataracts. Okay, for your physical exam, okay, the doctor may review your medical history and test that assesses the health of your eyes. Okay, your physical exam may include but not limited to visual acuity, pupil response, eyelid, and cornea, eye muscles. Okay. Your Snellen chart, your Snell exam is also known as your Snellen eye chart test. This is a vision test that measures how well you can read letters at a distance. Okay. For your height, okay, your height is usually listed on your driver's license if you're in Ontario or Canada. Okay, however, the doctor may also use a height measuring scale. For your weight, okay, the doctor or the staff may use a weighing scale. Okay, for your hearing, okay, so again, this has to do with your physical exams. Okay, so when it comes to your physical exams, the doctor may check for hearing loss. Okay, so hearing tests include but not limited to whisper test, tuning fork test, okay, speech discrimination test, okay, pure tone audiometry. Okay, heart, okay, you have apical rate, rhythm, murmurs, and blood pressure. Okay, so your apical rate, this has to do with your apical pulse, the rate at which your heart beats when you're resting. Okay, normal range, okay, normal apical pulse rate is anywhere between 60 to 100 beats per minute. Okay, factors that affect apical pulse: activity level, stress or anxiety, age, so on and so forth. Okay. So for your physical exam, the doctor may perform this exam, okay, using a stethoscope. All right, your heart rhythm. This is an irregular heartbeat. Okay, if you have an irregular heartbeat, you have heart arrhythmia. This is when the electrical signals that tell the heart to beat don't work properly. Okay, heart arrhythmia may feel like a fluttering, pounding, or racing heartbeat. Okay, some heart arrhythmias are harmless, others may cause life-threatening symptoms. All right, so when it comes to symptoms, you have a fast heartbeat, slow heartbeat, chest pain, shortness of breath, anxiety, feeling tired, lightheadedness or dizziness, sweating, so on and so forth. All right, so again, for your heartbeat, the doctor may use a stethoscope for your physical exam. Okay, heart murmur. This is an unusual sound in the heartbeat that can be heard with a stethoscope. Okay, can be caused by turbulent blood flow through the heart. Causes include but not limited to defective heart valves, congenital heart disorders, anemia, pregnancy, hyperthyroidism, so on and so forth. Okay, treatment include but not limited to surgery, antibiotics, blood thinners, okay, water pills, so on and so forth. Okay, for your physical exam, the doctor may use a stethoscope, evaluate vital signs, and ask about your medical history. Okay, when listening to the heart, you're looking for loudness, location, pitch, timing, and changes. Okay, other exam findings include but not limited to thrill, okay, vital signs, exercise capacity, symptoms. Okay, blood pressure. This is a force of blood against your artery walls. Okay, you're looking for systolic and diastolic numbers. Okay, what's considered normal? Blood pressure reading of 120 over 80 is considered low risk. A reading of 121 to 134 over 80 to 84 is medium. And a reading of 135 plus over 85 plus is considered high risk. Okay, what can affect blood pressure? You have stress, plaque buildup, being overweight, not getting enough exercise, eating foods high in sodium, smoking, drinking too much. All right, so when it comes to your physical exam, the doctor may use sphygmomanometer, okay, or a blood pressure monitor. Okay, this is a device that measures blood pressure. All right. Next up, you have your locomotor for your medical examination. Okay, this covers your upper extremity, your lower extremity, your neck and lumbar. Okay, so for your upper extremity, this is a part of the body that covers your arm, hand, wrist, and forearm. Okay. Your physical exam evaluates the structure and function of the upper limbs, includes the muscles, joints, bones, and nerves. Okay, when it comes to inspection, you're looking for skin conditions like rashes, redness, and scars. You're checking for muscle wasting or atrophy, looking for swelling or deformity. Okay, so the doctor may ask you to perform a range of motions, okay, such as extending and flexing your elbows, okay, so on and so forth. All right, to check for upper extremities related disorders and symptoms. Okay, your lower extremity, okay, so locomotor systems in the lower extremity are body's ability to move, which is made possible by bones, muscles, and joints in the hips, thighs, knees, legs, ankles, and feet. Okay, so when it comes to your lower extremity, you have injuries to be taken care of. Okay, you have locomotor capabilities. All right, so when it comes to your exam, the doctor will assess the movement, balance, and strength of the lower limbs. Okay. Neck and lumbar. So these are both part of the human body spinal column, which covers locomotion. For your physical exam, the doctor may assess the patient's ability to move around freely. Okay, focus on range of motion and function of the neck and lower back, including inspection for any abnormalities, palpation for tenderness, and testing of muscle strength and reflexes in these areas to figure out potential musculoskeletal issues. Okay, your chest and abdomen. Okay, so your chest and abdomen physical exam. This covers listening to the sounds of the chest and abdomen with a stethoscope and visually inspecting the area. Okay, next up you have urinary. Okay, you have urine protein and glucose. Okay, so this may have to do with your urine test, where you provide a sample of your urine for a lab test. Okay, so urine protein, this is a urine protein test. It's a non-invasive test that measures the amount of protein in your urine. Okay, it's often part of urinalysis, which covers physical exam of your urine sample. All right, so urine protein test. Urine protein test can be used to diagnose or monitor kidney disease. It can also help identify other health problems. Okay, can be performed as a single sample or over a 24-hour period. The 24-hour test is more accurate, but may be inconvenient. Okay, so a normal result is less than 100 milligrams of protein per day. Abnormal results can be caused by a number of conditions, including kidney disease, high blood pressure, and diabetes. Your urine glucose test. This is a test that measures the amount of sugar in your urine, often part of urinalysis. Okay, this is a general health check that measures various substances in your urine. Okay, so purpose of this test, this has to do with checking blood sugar levels. Okay, so procedure: provide a urine sample. Okay, use a dipstick with color sensitive pad to test the sample. The color of the dipstick indicates the level of glucose in your urine. Okay, diabetes. Okay, your physical exam may include but not limited to checking vital signs, eyes, feet, and other parts of the body. Okay, for vital signs, you're looking for height, weight, and waist and hip circumference. Okay, checking blood pressure, including when standing. Okay, checking heart rate and lung sounds. Okay, for your eyes, you're checking for visual acuity, looking for signs of cataracts. Okay, and performing other tests. For feet, you're checking for signs of poor circulation, checking for blisters, cuts, cracks, and sores. Okay, testing sensation in the feet, checking reflexes, so on and so forth. All right, so apart from that, okay, when it comes to treatment, if you do have diabetes, okay, you may need to indicate what kind of treatment you seek for this disease. Okay, there are many types of oral medications that can help treat diabetes, okay, such as the ones listed over here. All right, so apart from that, you also have a diabetes relevant diet, which covers eating healthy foods and limiting unhealthy fats and added sugars. Okay, when it comes to diabetes, you also have insulin, okay, to consider on your medical examination. Okay, so for insulin, all right, okay, this is a hormone that helps regulate blood sugar levels in people with diabetes. Okay, people with type 1 diabetes need insulin injections every day to stay alive. People with type 2 diabetes may need insulin if other treatments don't work well enough. Okay, insulin can also be used to treat gestational diabetes. Okay, so again, insulin can be taken using a syringe, pen, or pump. Should be injected in the same general area of the body for consistency, so on and so forth. Okay, next up you have hypoglycemia. Okay, this is a physical exam. Okay, so for physical exams, you may have the doctor checking your vital signs, your head and eye exam, and neurological exam. Okay, so head and eye exam, you're looking for blurred vision, okay, pupils, okay, jaundice, okay, and other types of pain and discomfort. Okay, neurological exam, you're looking for coma, confusion, fatigue, loss of coordination, stroke syndrome, tremors, convulsions, so on and so forth. Other tests include, but not limited to, blood tests to check blood sugar levels, fasting and watching for symptoms, eating a meal that could cause symptoms of low blood sugar. Okay, so when it comes to circumstances, okay, causes can include, but not limited to, medications, excessive alcohol drinking, okay, some critical illnesses, long-term starvation, insulin overproduction, hormone deficiencies. Okay, so loss of consciousness. Okay, low blood sugar can cause loss of consciousness. This can occur if left untreated or if the blood sugar levels drop too low. Okay, symptoms include but not limited to shakiness, sweating, weakness, headache, confusion, so on and so forth. Okay, treatment. Okay, you've got different ways to treat this disease. Okay, hypoglycemia or hypoglycemia, decrease in cognition. Okay, this disease can significantly decrease your cognitive function, impacting areas like memory, attention, decision making, and overall processing speed. All right. Okay, gait and stance. Okay, so Neurological gait abnormalities are changes. Okay, your changes in walking patterns that can be caused by neurological conditions. Okay, these abnormalities can include changes in stance, base width, and step size. All right. Neurological reflexes. Okay, these are involuntary response. Okay, or involuntary responses that indicate the health of the nervous system. Examples include tendon reflex, bicep reflex. Okay, so on and so forth. All right. Neurological tremor and coordination. This has to do with involuntary shaking or trembling that affects one or more parts of the body. Okay. So when it comes to your physical exam, you're looking for the ability to perform smooth and accurate movements, okay, which is often controlled by the cerebellum in the brain. Okay, so some of the tests include, but not limited to, closing your eyes and touching your nose with your finger, moving your arms and legs, performing fine motor skills, walking a straight line, okay, rapid alternating movements, or RAM. Okay. Mental competence. This is a legal term that refers to a person's ability to make rational decisions and understand the consequences of their actions. Evidence of emotional disorder. Emotional disorder can manifest in a variety of ways. This includes changes in mood, behavior, and thinking. Okay. So when it comes to emotional disorder, all right, this is something that you have to mention on your medical examination. So mood changes, feeling sad, extreme mood swings, okay, hostility, excessive guilt, okay, thinking changes, difficulty concentrating or focusing, problems with memory, delusions, illogical or magical thinking. All right, instability. Okay, so this has to do with your emotional disorder. Okay, so emotional instability can be a symptom of a number of mental health conditions such as borderline personality disorder, BPD. Okay, signs include but not limited to mood swings, impulsivity, difficulty calming down, unexpected reactions, relationship difficulties, so on and so forth. All right, so for your physical exam, okay, you're looking for medical history, family history, motor activity, psychomotor activity, and other tests such as lab tests, imaging, so on and so forth. Okay, so again, emotional disorder, psychosis. Okay, so affective psychosis, the mood disorder that include psychotic symptoms, which covers hallucinations and delusions. Okay, symptoms, other symptoms include inappropriate behavior, withdrawing from others, difficulty concentrating. Okay, difficulty telling reality from fantasy. All right. So for your physical examination, this is a condition that can occur in a variety of mental and physical disorders. Okay, this exam may cover a complete physical exam, which covers a neurological exam, a review of systems, okay, mental status exam, lab test, okay, so on and so forth. All right, now, furthermore, you have drug habituation. Okay, so studies found that people with a mental disorder, such as anxiety, depression, PTSD, may use drugs or alcohol as a form of self-medication. All right, so again, this has to do with your medical examination, okay, with a yes or no answer. So whether this person is addicted to drugs or medication, abuses drugs or medication, yes or no. Okay, so when it comes to your drug habituation, you do have the drug abuse screening test. Okay, this is a 10-item brief screening tool. Okay, more like a medical questionnaire. Okay, this tool assesses drug use, not including alcohol or tobacco use in the past 12 months. Okay, mental competence, neurosis. Okay, again, this has to do with yes or no on your medical examination. So the healthcare provider may perform a physical exam and a neurological exam to check the person's nervous system and mental health. All right. So for your physical exam, the healthcare provider may examine the hands and the arms and look for signs of substance misuse. Okay, so on and so forth. Okay, alcohol use. There's a screening test for alcohol use disorder. Okay, more like your medical questionnaire. Okay, you may also use a breathalyzer. Okay, that is for immediate alcohol use. Apart from that, you also have urine and blood tests to check for alcohol use. Medical history. Okay, again, on your medical examination. Okay, your medical history may cover medications, failure of an organ when it comes to cardiovascular disease, as well as other disease and symptoms. All right, so this is basically all there is to it when it comes to your medical questionnaire and your medical examination for your medical report. Okay, if you're applying for a transit or bus driver relevant positions. Okay, so we'll now go ahead and fill in your medical report as well as your medical examination.